question in terms of guidance for primary care providers. We've been talking about some of the issues about side effects and changes, some of the health and wellness issues, even some life changes, developmental changes that might be taking place with puberty. How would you recommend that PCPs identify those times when they really want to refer back, even if an individual is well managed, to the neurologist to answer some of these questions, versus when maybe it could be something that the PCP could talk directly with the specialty provider with to do some of that co-management?
Working to get a flow chart or a flow scheme for an individual patient would probably be the way, and if that came to be complicated or not working well, that would be a time to refer back. I think the general idea would be for the PCP and the specialist to work together to look at a trajectory a few years out. That segues into the transitional clinic idea, because neither the primary care doctor, if it's a pediatrician, or the specialist, if it's a pediatric neurologist, is going to be managing the patient for all times, and they may continue to have seizures through to adulthood. So along the timeline, it would be also important to think about that. And I think referrals, one of the things that we do in some of the clinics is to have the patient seen once a year, or less even, if it were such that the situation's totally under great control and there's no issues. But if an issue came up, or there was an issue that hadn't been anticipated, that would be the time to refer. Otherwise, I would think for a stable situation, yearly, annual, and telephone calls or communication in between time to manage and co-manage if there's an issue that can be dealt with. It doesn't require bringing the patient in.